Hello, and welcome back to Lifestyle Medicine Global. Today we are going to talk about cholesterol. What is elevated cholesterol? What causes elevated cholesterol? And how to fix the problem. So, what is considered normal cholesterol? So, total cholesterol under 200 is considered normal, and for LDL, which is your bad cholesterol, under 100 is considered normal as well. But I can tell you that those numbers were based on studies that were done that showed significant increase in cardiovascular events, so heart attacks, strokes, when the total cholesterol was over 200 or LDL was over 100. But that does not mean that under 200, total cholesterol under 200 and LDL under 100 is that you're not going to have an event. In fact, it has been shown that still people are getting cardiovascular events even with what's called normal cholesterol. So what is considered heart attack proof cholesterol is your total cholesterol under 150 and LDL, which is your bad cholesterol, under 70. So this is the numbers that you want to achieve. But you don't want to achieve these numbers through medications, because you are not, fully protected with this kind of treatment. If you're just treating it with medications, you can still get a cardiovascular event. So you want to do it in a way that gives you the most protection. So what are the different classes, or what are the different kinds of cholesterol we have? So we have your LDL, which is your bad cholesterol. That's the big problem. And then we have HDL, which is your good cholesterol, and triglycerides, which is another kind of cholesterol. So you want to lower your LDL for sure. The HDL, before we used to say we need to increase it, but it has been shown in studies that we don't have to worry so much about it. So we worry about the LDL and we worry about the triglycerides. So what causes an increase in LDL? LDL is increased by trans fats. So trans fats are found in factory-made foods, which have been made with hydrogenated oils. So these processed foods can have trans fats, and these can really stimulate the liver to make bad cholesterol. And also saturated fats. And saturated fats are coming mainly from animal-based foods. The meats and the dairy products. Cheese is 70% fat, and most of that is saturated fats. And your fish, still, even if it's considered a healthier quote-unquote option, still it's pretty high in saturated fats. And eggs. So these kind of foods increase the cholesterol. And then that there are also plant foods that are high in saturated fats, and that's palm oil and coconut oil. So you want to be careful with that as well. Also, there are hereditary conditions that can lead to high cholesterol, but those become insignificant once you have a healthy lifestyle. If you're smoking cigarettes, it can increase your cholesterol. If you have diabetes, if you're obese, all these things can really contribute to these problems. So how do you fix the problem? So to fix the problem, obviously, is to fix what is causing it. Avoiding processed foods, these factory-made foods that we find in the freezer section, or pastries, or these shelf things that we buy from the shelf that have a long shelf life. These foods are really stimulating livers to make cholesterol. And then animal-based foods, animal-based foods are not necessary. At least for most people, they're not necessary, unless you like in those desert food places, but they're not necessary for our survival. So, and the thing is, we're eating this kind of foods and they're affecting our health, and they're not necessary for most of us. So we can really work on eliminating these animal-based foods. And as I said, cheese being 70% fat, I don't know why we eat this food. And people love it because of casomorphine. I said it's a weak opioid that makes people get hooked to it. So these foods we need to eliminate from our diet. And then what are we going to do? Then we need to adopt whole food plant-based diet. So this is what was meant for our body. Plant foods is what is meant for us. The plant foods, they don't have cholesterol. They're very low in saturated fats, again, except for the two that I mentioned, coconut oil and palm oil. So these plant foods, whole grains and legumes, which is your beans, lentils, peas, and vegetables and fruits, and nuts. Use nuts carefully because they're good fat, they're high fat, high calories. So you want to use them, especially if you're trying to lose weight. You don't want to do too much of that. And then seeds, so you eat these kind of foods, you get all the good nutrients, the phytochemicals, antioxidants, fiber, minerals, vitamins, and water, and all these really help the body. And the fiber helps to eliminate the cholesterol as well. So this kind of diet will really help, and I've seen it help patients decrease their cholesterol significantly. And some of these patients are not even doing 100% plant-based. So you can see how, like, if you're really doing it and going 100%, that this can really significantly change your cholesterol. And we worry about cholesterol a lot because we know that heart attack is the #1 cause of death in America and worldwide now. And this is the cholesterol that's clogging people's arteries, the bad cholesterol. So that's why we really need to address this problem. And you're not going to know unless you get checked. So make sure to get checked. And one of the earliest signs of clogged arteries is erectile dysfunction. Erection depends on a healthy blood supply. And once you start to get those small blood vessels clogged up, you don't have good blood supply, you start to have erectile dysfunction. So if you're having these kind of problems, please get checked because you probably have clogged arteries. So fixing the diet, exercising, losing weight, having healthy weight, not smoking, not drinking alcohol, because alcohol can also contribute to triglycerides, which can increase because of concentrated sugars and high fat foods. So you want to stay away from these kind of, as I said, alcohol and smoking and this kind of things. So that's really what you need to do, not medications. Medications, you can have low cholesterol and you can still have a heart attack, a stroke, because you don't have the protection. And especially if you're not eating healthy, you're not eating these plant foods that are protected, you can still have a cardiovascular event. But the problem can be fixed by fixing the diet and decreasing your cholesterol, decreasing your risk of heart attack and stroke. And you might not decrease it 100%, but I mean, your diet can do this 80% or so, can decrease your risk 80% or so. I mean, if you had a medication that can do that, that would be amazing. So this is really amazing. And this is one thing that you can do. Adopting a plant-based diet is one thing that you can do that affects all kinds of diseases. It affects your life so much. So it's something that you really want to think about adopting, for good health and, for our environment and our environment. I'll talk about that some other day. But for today, that's how you solve this problem. And I would like to see your comments. So please let me know what you think. And thanks for watching, and see you next time.